Bronx, New York. It's Rita Hubbard-Robinson, and this is the Millennium Health Maters radio show. I'm your host, and I've got two fantastic guests with us today. One who's been a longtime friend and colleague, and the other who I've met more recently in the last year, and I want to welcome them both to the show. Before we get started, it's a great day. I don't care what it looks like outside. It's always a good day to get some exercise in, so if you don't want to go outside, use the stairs in your house. You are a stair master. Yes, you are. 2 stairs up, 2 stairs back. Or with your favorite music for about a half an hour. It's good for your heart, it's good for your health, and your health matters to us. We have a big event today at the Workforce Training Center on Northland Avenue. It's the Northland Harvest Fest. We want you to come out, bring your family. There are giveaways, activities, and it's all about having fun during the holidays. So please come out from 10 to 2, right at 683 Northland Avenue. We'd love to see you there. I'll be there ready to give you my autograph if you want it. But we look forward to seeing you there. There's food, there's activities, there's fun, and again, there are giveaways, bicycles, coupons for corner stores that are healthy now, and other wonderful things. But I want to get right into the show. I want to talk today with 2 colleagues of mine, and we want to talk about wrapping emergency room patients with compassionate, comprehensive care in Niagara Falls. And we've got with us Sheila Key. Everyone knows who she is. If you don't, she is the COO of the Niagara Falls Memorial Medical Center, and with her is Steve Nelson. He is the Director of Value-Based Payment and Performance at Millennium Collaborative Care. And we're glad to have you both on. Good morning.
Thank you.
A real pleasure to be here with you, Rita.
Yeah, thank you. Listen to that wonderful radio voice that Steve has.
Yeah,
I do have a background in radio.
Oh, how about that? So I
I
feel the pressure. I do. So why don't you start us off, since you've told us a little bit about yourself. Tell us a little bit about your background and how you got to where you are and why you love Buffalo so much.
Oh, I could go on for hours, I guess. But I've been with Millennium for a year now, in the role you were just describing. And what that means, I spend a lot of time working with our partners, getting them ready for the way the health system is transitioning to payment for value as opposed to just getting payment for every service that they do. You know, really paying for outcomes. So that's this whole buzzword of value-based payment, and that's kind of my life at the moment. Before that, I worked in the health insurance industry for 10 years, and so I've gotten to see, a number of sides of the healthcare system. Why I love Buffalo, this is my home. I grew up here, and there's just so much energy and so much excitement going on in the community these days. There's a lot to offer. It's a great place to raise a family, and I'm thrilled to be here.
Did you go to school here,
I did.
Steve?
Yes.
Whereabouts?
So I went to Buff State.
Mm-hmm. And so you can go to school here locally and have a lucrative job, lucrative enough for to work with a family. And I always like to point that out, because people say, oh, you go away, you don't come back. But you can go away, you can come back, or you can stay here and have a family here. So thank you so much for sharing that with us this morning. Sheila, tell us a little bit about yourself.
Yes, wow. So I started off in the world of government and politics. I was at the Erie County Legislature, Chief of Staff. I became County Director of Budget and Management. And then they asked me to come to ECMC to help with some things. And from there, I've had other leadership positions in healthcare organizations. One of them that I was very thrilled about was heading up the Community Healthcare Association of New York State. Representing 52 federally qualified health centers throughout New York City, upstate, mid-state. Then I came back and worked with the state health department, and I've been at Niagara Falls Memorial, I can't believe, 10 years now.
Wow.
So it's been a very, very exciting career.
And you've done all that in about 21 years. That's pretty
right.
amazing.
Right.
So, and why do you love this area? I know you're between Buffalo and in the region and Niagara Falls now. So tell us about that part of your life.
So I was born in Binghamton, New York. I came up to Buffalo to go to college. I loved it, and I stayed.
Yeah.
So I've been here for more than 50 years now.
Wow.
Yeah.
I went to school in Binghamton, believe it or
Oh,
not. Yeah.
okay.
And but I'm originally from downstate, I should say,
Right.
and New York City, and then I came to Buffalo for law school, and I've been here ever since.
Yep.
So I got my chops, for those who are listening, working at the Erie County Legislature for Sheila Key early on after law
Yes.
school. So
Yeah.
we've known each other. I was just a mere 2 or 3 years old then, so it's just been a short time. So really
Right.
glad to have you on.
Thank
As
you, Rita.
my grandmother would say, make new friends but keep the old. One is silver and the other is gold. I'm rich this morning with the two of you here today. And so let's talk a little bit about what's happening and this partnership and this work that both Niagara Falls Memorial Medical Center and Millennium Collaborative Care are doing, and how this work is so important to the future of healthcare, and certainly most importantly, patient-centered care. So either one of you can, maybe Steve, you start us
Sure.
off.
Would you like me to give you a little background on,
Yeah.
on the program?
That's
So
it.
Millennium has what's called an innovation incentive program for our partner organizations. So that includes our hospital partners like Niagara Falls Memorial, Kaleida, ECMC, our primary care practices, behavioral health partners. They can all apply for funding. Essentially, it's like a grant program to roll out innovative programs to transform care, do things that just are a little bit different from how we've normally tried to address care. And the nice thing about getting a grant to do that is that it doesn't necessarily have to be services that are billable for insurance companies. So in a lot of cases, providers don't have the ability to do the types of activities that they know would have great benefits for their patients, but they just can't afford to do it. Because it's not something they can bill for.
So this is, in fact, this is where the word innovation comes in. This is, we're
Exactly.
trying to drive to a place where we can inform healthcare and insurance companies on what will work to manage population health. And we've talked about population health on our show in the past, and why don't you give a little clarity about that? What's happening in the world of health that's really driving high costs?
Well, so it's a great point, and
Yeah.
there are studies all over the country about what activities we can do to address what we call the social and behavioral determinants of health. Right, those things that might drive up your hospital utilization. That aren't really tied to your medical care. It's more just the social and behavioral factors that go on in your life. So, an easy example would be for people who are battling homelessness, right? Different organizations have found that if they work really hard to help get stable community housing, people will stay out of the hospital more.
Right.
It improves their overall health. And
I
there's
mean, you can
literature.
imagine if you're sleeping on the street, it's not the most healthiest environment for you to live in, and certainly would affect at some point your health.
Absolutely.
Between getting a cold or any other ailment that might occur from just not resting well and not eating well and all of those things, you can imagine a person could find themselves in a cycle going in and out of the hospital. And so this is great that the Millennium Collaborative Care is in the position to help really deal with some of these really hard areas where there's no funding to figure it out, right? So why don't you share with us, Sheila, some of the ideas that you've come up with and where Niagara Falls Memorial Medical Center is going?
Right. Thank you, Rita. So we all know that maybe even half of all the emergency department visits are triggered by a social or behavioral problem. Not a medical emergency, as a lot of people think, but some underlying reason why they're there. Because an emergency department becomes a safe haven. And in Niagara Falls, we really are a safe haven for those who have no shelter, no food, and they come to our ED. So
What's that? What's an ED?
Emergency department, I'm sorry. I keep using that term. But I do want to point out that we have a program that has different focus points. The first is we started a program for folks that had 10 or more ED visits in a year. These are folks who keep coming in. In fact, we have 5 clients with an excess of 100 visits.
Wow.
Very, very difficult. To deal with, extreme cases, we have a social worker assigned just to them.
Wow.
Then we have, for the regular, what we call hotspotters, high ED utilizers, They come in to the ED, they get registered, and it triggers an alert, and it puts together our intervention team. And we work with them on what's the problem, how's your housing, really focus on the social determinants of health. In addition, to be able to avoid those visits, because it's very costly to the government
Right.
to keep paying for emergency department visits.
Mhm.
We have a sandwich program, so sometimes people just want a little chit chat, want
Cup of
to,
coffee?
yeah, you know,
Warm?
talk to somebody,
That's
have a
right.
little bit of comforting conversation. We give them a free sandwich. Since we started that, we've diverted about 575 ED visits just by giving them, maybe it's either bologna or it could be egg salad, depending on the day of the week. We also have installed on a wall phone in the ED so that if one of our social workers is not readily visible, they go over there and it triggers a phone call to one of our social workers. We come right out and again have that comforting conversation to avoid a ED visit. So there's so many techniques that we've adopted, but the true measure of our success, I believe, is that we have social workers who provide comfort, care, and compassion. And they establish dialogue with these patients. And a lot of times, if they don't come to the ED, they'll give one of our social workers a call. So that works very, very well.
So that diverts people from the hospital, but are we moving toward, with the social worker, addressing the underlying issues at
We
all?
do,
Yeah.
yes. For example, we have a partnership with a group called Addict to Addict. And, you know, a lot of folks have substance abuse issues. And one of their counselors come right into the ED because we know sometimes people have a hard time finding and connecting themselves to an agency. We also have home care agencies that come right into the emergency department. We're actually placing people from the emergency department into nursing homes. So the whole notion is to have all these agencies come to the emergency department to give us the extra tools we need to connect people to care. That's the critical factor.
So I know, this term, we've been talking about it for many years now, patient-centered care. And so this to me is another opportunity to get to the actual patient and find out really what's going on and asking the right questions.
Right.
So can you talk about that? Do you have have you made a shift in your emergency department to ask the right questions? You want to talk a little bit about that, Sheila?
Yes, so we use a technique called motivational interviewing. All of our folks have been trained in how to discuss these sort of topics with a client. And it's hard. Sometimes they don't want to tell you what's going on. So we have a little, what we call social determinant of health assessment tool. And we find out really what's going on. Like, for example, recently we had a lady who wasn't really talking to us a lot. We used our tool. We found out that she was in the ED because her toilet wouldn't flush. So you can get at
Interesting.
some of these really deep root cause issues that trigger that ED visit.
Isn't that interesting?
Yeah, so.
That's, as the kids say, that's the darn, no, kids don't say this anymore. But then, when I was a kid, that was the darndest thing. So, tell me about root causes. They're like, there, I'm sure, statistics that are driving your thought that we need innovation in the ED. What's really happening to us locally and nationally with regard to, as you said, people coming in for a need for a plumber and or a need for a sandwich? What's happening to us statistically? What do the numbers look like and so on? That are causing us to say, wait a minute, this is very costly. Can you talk to that?
Yes, I know that some of our success, I can give you some of our outcome data. For example, for these high ED utilizers, over the last 10 months, we've reduced their utilization by 20%. Doesn't sound like a lot, but it's been a great victory for our team at Niagara Falls Memorial.
But that translates to a lot of money.
It is a lot of money. I have to put a price tag on it,
Yeah,
but
that's gotta be,
yeah, it's
'cause
hundreds
very
of thousands of
yeah,
dollars. Yeah. And unfortunately, the health plans are not. They're benefiting from savings, and our goal is to get them to share some of those savings with us. We need that.
Yeah, Steve, can you talk a little bit about that? I think that
Sure.
that's probably where we're trying to go, right?
Yes, and long term, absolutely, that's where we're trying to go. Part of the innovation incentive program is criteria for performance metrics, we call them, that our partners have to target in rolling out these programs. So that could be things like reducing avoidable ED visits or readmissions, making sure best practices are followed through with things like follow-up after a behavioral health discharge. So, it's best practice for somebody to be seen within 7 days and then again within 30 days when you're discharged from a behavioral health unit in a hospital. So, we are targeting those metrics as part of this program with the focus that health plans and the insurance companies are also responsible to drive those kind of quality improvement measures as well. So when New York State, for example, looks at the Medicaid plans around the area, they are looking at similar performance data to say, okay, how are you performing as a health plan? Are you following these best practices? And so, long term, as Sheila said, the idea is as those get improved, as those metrics are improved upon, the insurance companies do better, and costs come down, and in theory, they should be saving some of those savings, sharing some of those savings with the providers who did the work, essentially the legwork to drive down that costly utilization.
And that's what that's what Millennium is supposed to be doing. I mean, this is what the initiative was all about. I know, Sheila, you serve on the board. Why don't you talk a little bit about what the overarching drivers are with Millennium and where it's trying to go?
Right. Well, in a couple ways, Rita. One is, of course, we have to have good empirical, quantifiable results. And I think that working together throughout Western New York, we've been able to achieve some very noteworthy accomplishments. But the other goal, and one that's not talked about enough, is to be able to identify future healthcare leaders. So my team members, I am counting on them to head a hospital someday or a health center, but these are leaders of the future. And they're learning skills, they're learning compassion, they're learning what it is their role should be in healthcare. And I am so pleased that we have a cadre of these young folks coming up the ladder. Hopefully will be serving our community in key positions for years to come. That's another important goal of this.
Yeah, and Steve, I know that there are other innovative grants that are going out. And again, just making clear what value-based payment is all about. We used to get paid for every time you go through the cycle, every time someone shows up, whether they've been in 100 times or 2 times. Every time they show up, a hospital gets paid, a healthcare office gets paid. That's going away, right? Can you talk a little bit about that?
To an extent, yes. So, I mean, that it's just this economic incentive, right? I work a certain number of hours, and in that time I want to see as many patients as I possibly can. The idea now is that that's all well and good, but how are those patients doing in their health?
Right.
How are you ensuring that these patients that you're charged with, that are in your practice, how are they doing? And you do need to make sure you're really following through with care. And so right now the industry as a whole is just looking at what does that mean? How do we best address it? And that's where this concept of social determinants of health comes in. What else besides just your blood pressure? What else do we need to look at? Oh, you don't have access to healthy food. You don't have fresh food. You don't even know how to prepare fresh food. What can we do to sort of help with that? Because the medical benefits of addressing that kind of thing are necessary. So, it's going to take a long time, honestly. I mean, it's a neat time because all the insurance companies, Medicare, Medicaid, everybody is looking at value-based payment as the wave of the future. And so we are working to roll it out across the nation. And so, the number of contracts between health insurance companies and providers that have a value component is skyrocketing. I mean, the goal is eventually to have it at 100%, right?
Right.
I don't know that we'll ever get to fully 100%, but that's the goal, and it's better for everybody. It's better for our system when you start tying in quality and real health into how we pay for care.
And along those lines, I know that, so this is sort of facing the healthcare industry, but there's a whole other part of the work that's looking at the community-based organizations as well, and to get them to be able to have the same language and, put people in the same room. I know you have an event coming up with the community-based organizations and healthcare together to sort of like, speed dating and all that kind of thing coming up. But if you would, just talk a little bit about even how we're in this world of innovation and VBP, or value-based payment, that we're looking to actually enable community-based organizations to work with hospitals like Sheila just described.
Yeah, so Millennium has been working on VBP readiness, we call it, with our community-based organization partners. What that means is essentially helping CBOs translate the work that they do into really quantifiable sort of outcomes that an insurance company or a provider can say, oh, okay, if I partner with you, you'll be able to do X, Y, Z for me and have very definitive sort of results. And, CBOs are the ones who've been doing the work in the community, boots on the ground, and they have the expertise. It's not fair to expect a primary care doctor who's very, very busy to know what to do about somebody who has food insecurity.
Go to school for it.
Exactly.
That's not a doctor's profession.
Right.
And in Niagara Falls, we've established a group about 3 years ago called Connect for You. And we have 50 different community organizations in our coalition. When we first started, people would say to me, we don't do health care. Why am I here? And now they don't ask that question. They understand their role in this bigger healthcare system. So I think that's a good thing.
Yeah,
And
it's all connected.
Right.
I went to a doctor, I said this hurt and that hurt, and he said, well, it's all connected.
Right.
So, that happens in the body, that actually happens to us in the community. One person, the same person, has need in a number of different areas. Healthcare is one of them, right? But it's all connected. So, like you said, if you're homeless, that's healthcare. If you're not eating, that's healthcare.
Right.
I went to a conference a few years ago, and was the vice president of Kaiser Permanente, and he said that, what's happening in the healthcare system is that they're getting paid for 100% of a person's health when they can only impact about 20% at the best.
Correct.
So what happens, the other 80% of a person's health really is addressed by things happening in the community. We call them CBOs, or community-based organizations, that are out here helping people every day be healthy. And so it's really wonderful. I know now the Department of Health in the last year or so has created a bureau of the social determinants of health. And so this is something that the state is saying is important. I know that the Robert Wood Johnson Foundation for years is the biggest foundation in the country addressing health. They have for years supported and funded projects around health. They have made a shift in the last couple of years saying, no, we need to do work on root causes or the social determinants of health. What are the root causes of a person's poor health? And I think, and I'm so excited that Niagara Falls is making this leap in their work, because there's so many people with variety of needs, and they don't know where to go.
Right.
And they see that beautiful hospital and they say, I'm going up there, I know those people there can help me, right?
That's correct.
That's really I'm having an emergency.
Yes.
And it says emergency department, I'm
Right.
going in there.
Right. And their emergency can be social.
That's right.
It doesn't have to
And
be
they don't
medical.
know where to go.
That's correct.
The stories too, Rita, that have come out of the Niagara Falls programs, and they have actually 4 programs currently live, innovation programs. But some of the just anecdotal stories of the impact they're having on people who are struggling with any number of things. It's very powerful. I mean, I like to look at the data. I like to see the actual results.
Right.
But to hear the stories
Tell
that
us
come
a
out of
quick
these.
one.
Well, for example, there was a gentleman that kept coming to the ED, and with a lot of probing and conversation, we found that he stopped going to his primary care doctor, stopped taking care of himself, because his son died from an overdose.
Yeah.
And he was in horrible grief and just let the world stop. And so we were able to connect him to good mental health counseling, nutrition programs, and now he stops by just to say hello. He doesn't want anything.
He's a neighbor now.
He just wants to say
Yeah,
hello. So,
yeah.
you know, if you take that kind of story and you multiply it many, many times,
Right.
that truly, you know, those are the super outcomes from what we're doing.
So there's a monetary savings as a result of what you're doing, but then there's a human savings about what you're doing.
Right.
And that's pretty amazing. I think
Right.
that's pretty special. And I want to just congratulate you and what you're doing and your team. I know you've got social workers on your team, nurses on your team.
Correct.
Can you tell me, you want to call any, you want to give a shout out to any of those wonderful people?
Yes, well, I want to say hi to Chuck Pecco and to Carol Meir and to Jenna Genovea and to all of our health home care managers. We work very closely with them as well.
Yeah.
So, and to Kevin Burgess, who works with our behavioral health clients. We've got a whole team. I don't want to leave anybody out.
Yeah.
But
All of you, we appreciate all the work of all of our healthcare providers. Some of the most compassionate people you'll find on the earth are right there at the Niagara Falls Memorial Medical Center. Thank you
Yes.
so much, Sheila Key.
Thank you, Rita.
COO of the Niagara Falls Memorial Medical Center, Steve Nelson. He is the director of the Value-Based Payment Project at Millennium Collaborative Care. We appreciate both of you and all the hard work you're doing to innovate medicine, to innovate services, and certainly to make the patient the center of care. This is Rita Hubbard-Robinson. This is Millennium Health Matters radio show. I'm happy to be your host. I look forward to seeing you either over at the Workforce Training Center today or back here next week, same time, at WUFO Mix 1080 and Power 96.5. So glad to see you. Thank you so much. Have a great day.